everybody. I'm going to be talking about comparative characteristics of different methods of open and closed rhinoplasty. So nowadays, rhinoplasty has plenty of surgical interventions that are focused on elimination and correction of the nasal deformation and defects. So besides that, aesthetic rhinoplasty takes leading places between another types of plastic surgery regarding to functional side, because external nose is the beginner part of respiratory tract and peripheral part of the human olfactory analyzer. Another very good side of the rhinoplasty side is aesthetic one, because external nose is one of the main objects on the face of a companion's close attention during communication. So it's necessary to follow next to results, such as functional result. It's about maybe improving or saving breathing, and aesthetic one. So nowadays, medicine literature has very blur bordings and indication for choice of some types of rhinoplasty, and this choice of method, closed or open, influence on the final result of the surgery intervention. So the choice of researching goals detailed by examination of patient with computer prognosis, and there are optimization of algorithm and treatment surgical planning by open and closed rhinoplasty, and of course assesses the result after this type of surgery. Now you can see on the slide objective of our researching. There are characteristics of advantages and disadvantages open and closed rhinoplasty, comparing characteristics of methods such as modeling methods of the nasal quadrangular cartilage and modeling methods of lateral and medial cruces of the nose, and lateral osteotomy for the bone pyramid correction, of course by open and closed accesses. And the less important thing is assessing the early and late complication after rhinoplasty. The subject of our research are 38 patients which have gotten aesthetic rhinoplasty from November 2018 until January 2020. And the average age of this patient, 35 years old. So patient can be divided into clinical groups. The first one, the patient who has gotten close rhinoplasty. It involves 21 people, where 14 women and 7 men. The second group is where patients had gotten operated by open rhinoplasty. It involves 70 people, where 11 women and 6 men. Patients are disturbed into groups as shown in table 1. Okay, on this slide we present you distinctive features of posterior and endonasal incision and external access. I want to add that endonasal access we recommend in such cases as a correction of osteocartilage pyramid of the nasal bone and resection lateral cruces and the lower third of quadrangular cartilage. So you know that in 92% of these cases we had a good result, but in 75% of these cases this kind of incision limits surgical motions. In contrast of this endonasal incision, external access provides full visualization and surgical error. It allows to assess the intraoperations tissues during operation, And as a result, and I want to add that we recommended a Rova's incision, this item is fine bird incision as most optimal. And for the septum correction, we recommend transversal through colamellar incision. So next slide shows us indication for open rhinoplasty. And definitely open rhinoplasty should be basic method for beginners in rhinoplasty area, and only after improving surgical skills and with sufficient experience, every surgeon could move on to close types of rhinoplasty. Otherwise, we decide that drawback of open rhinoplasty is high risk of keloid formation, and by comparison, close access is more aesthetic and cosmetic. And now you can see the picture of our patient with keloid scar. So correction of lateral and mesial cruces of the cartilage is one of the most common and popular interventions during aesthetic rhinoplasty. And we propose three main interventions, which you can see now on the screen. So each has certain individual indication, but the main principle is minimization as much as possible of the applied surgical trauma and preservation of the tip support and its biomechanical capabilities. So in our clinic, we often use non-exposure intervention, which you can see on the slide. So it should be noted that retrograde access almost doesn't use nowadays, and it's replaced by exposure of great cartilage of the nasal wing. And we identified indication for this method, such as asymmetry of the nose, bifurcated tips of the nose, the case when it's necessary to receive a maximum rotation of the nasal tip up and decrease protrusion of the nasal tip up. We developed in our clinic our Esther's technique with making bordering section along the caudal edge of the lateral pulse with its transition to the medial, which allows shown surgical intervention, which you can see right now. Okay, osteotomy. Nowadays, it's very popular to change lengthening of the nose length, and it's connected with the whites at the base. Particularly, it can be reached by lateral osteotomy and with open or closed access. And the throwback of this method is we can have some iatrogenic fractures of the nasal bones, which is a very traumatic stage of the every rhinoplasty, and it's accompanied with skeletization of nasal bones. From another hand, this method is very dangerous because the surgeon has only tactical sensitive during close access, but it's the most cosmetic and invisible methods, and we consider that these methods can be one of the most not popular in most cases. Because the main criterion of every aesthetic plastic surgery is the most aesthetic result. Yeah, and now you can see our patient before and after osteotomy. Complications. So now you can see a list of complications, and the first is typically for open rhinoplasty, such as nasal bleeding, subdermal hematoma, swelling, and skin necrosis. And another one, such as blind nose, valvular nose, asymmetric nasal dorsum after rhinoplasty, incorrect lateral osteotomy, asymmetry of nasal tip. This is typically for closed rhinoplasty. And now you can see the pictures of the complications. Conclusions. In conclusion, I want to summarize and repeat again that open rhinoplasty has advantages as a full visualization, and it's very easy to assess interoperation tissues of nasal deformations, and it's very easy to avoid some complications such as bleeding, but disadvantages of this method is high risk of keloid formation. And what about closed rhinoplasty? As for me, it's the most aesthetic one method, and but drawback of this type is, of course, non-poor visual of interoperation, but we should leading this method because aesthetic rhinoplasty is, of course, about invisible and aesthetic cosmetic results. Thank you for your attention.